All right, we're live. So welcome to this morning's discussion on the baby shower. Where would we like to start?
Um, do we want to give a summary of the?
Whatever you want
Okay.
to do.
Well, I'll talk about something that I thought was funny in the baby shower. I thought it was funny when at the end, when they're at the baby shower in the apartment, one of the women confronted Jerry about a bad date that they had. And everyone kind of accepted that the woman was like being really mad about a date, but when Jerry's friend wanted to confront the other woman because he was a man, I think everyone was like, "Oh, you can't do that." But when the woman did it, it was like, "Oh yeah, she's flying off the handle." Like it was more acceptable, I guess.
Yeah, I think there's a double layer to this.
Mhm.
And we'll focus on George first. Um, with George, I think self-disclosing, there was the feedback that he was either overreacting or carrying it too far, that there really wasn't anything there without really knowing the details, meaning that we never observed the actual date in and of itself. And that's probably true. And I think one of the teaching points, especially carrying it over to a clinical role, would be how we, as a group, as psychiatrists, would formulate human behavior in general. So I think that one aspect would be for us to kind of frame things along what precipitates, um, even predisposes, and perpetuates behavior. And in our cases, that's usually abnormal behavior. And then, of course, also at the same time, looking at it through the lens of what's biopsychosocial. And here we would look primarily at the social construct of George's behavior and whether or not it's abnormal. What was he perseverating? Was he obsessing? Does he have OCD? Or is this just something that is state dependent and otherwise normal? I think those are a couple of teaching points when we look at things specifically in terms of how George behaves in this particular episode. Um, One of the things that allows us, and if we might just say that George appears anxious and maybe he is preoccupied, with preoccupation being a sign of anxiety, um, whether or not it's state versus trait, and we actually have bedside scales, psychometric tests that can show that different aspects of anxiety are either state dependent versus trait dependent. Is the individual anxious? Is George anxious? Is he preoccupied? Largely because of his current state. That is, it was the date that precipitated it, and any one of us in that similar situation would have behaved the same. Or is it more trait dependent? And then I think if we were to give George Costanza such a psychometric test, does it, or is it consistent? Would those objective findings be consistent with our subjective medical opinion? And I think towards that end, one of the things we would do as clinicians is inquire and see if George tends to act like this. Is this trait dependent? Is this who he is? And anybody have a gut towards that, seeing prior episodes?
Yeah, so on that point of like the compulsion, when I was watching it, something was particularly, I don't know how to say this, otherwise but unhinged, was keeping a chocolate for like years. I think points us in the direction of like an unhealthy compulsion obsession, with like being meditative planning of your friend or some person you met that you have like a bad experience with. I feel most people would not want to be in that environment, right? You kept the chocolate shirt that is a continuous reminder of like a somewhat traumatic event for them.
Yeah. And the idea here would be just to kind of uh, flip words that and summarize what you just said. His keeping that shirt does not appear to be consistent or explained by a culturally sanctioned norm.
Yeah.
So this is not normative behavior. This is not normal, right? And therefore, it's likely abnormal, falls outside of a particular culture, even for Manhattan, right? That said, we could even take it one step further to strengthen this medical perspective, and that is in previous episodes, George's past psychiatric history, if you will, we see this behavior again. This does seem to be more trait dependent. And moving from the idea of what is abnormal towards what is even abnormal and disordered, it does result in clinically significant distress and impairment in George's functioning. We see this trait dependent behavior certainly adversely impact his interpersonal relationships, girlfriends, even his fiance. And then even his occupational functioning as well. He goes, not seasons, but certainly episodes, being unemployed and having difficulty, well, seasons, having difficulty maintaining an appointment.
You know, it's interesting though, because at the end, he like said this one line, he was like, every woman has like control over me, but I, like still want all of them. So he seems still somewhat like aware of like the situation is, but not so much that he's in control that not keep a chocolate shirt for like a year.
Insight cuts across every mental disorder from the most acute adjustment disorder to the most chronic and persistent schizophrenia. So levels of insight across that entire spectrum. That sounds like something George would say in an office appointment with a psychiatrist.
Yeah.
And as a future psychiatrist, not that you would react to it, but what thoughts come to mind that you might just take note of, whether it's something you engage in a conversation with George in the here and now, or leave it for a time where when George might be ready, you bring it up. What's going through your mind?
Well, he said like every woman in my life or something, so I think you want to know how far back that goes, like are we talking starting with your mom and going forward, or like a sister or something, like who are these people in your life?
Yeah, and I like the way you kind of phrase that, because I think to put words in your mouth now. I think we begin with open-ended. How far back does this go? But if George doesn't take us there, because avoidance might be a defense mechanism he'd employ there. And if you don't get the answer from the open-ended question, then you're, as a clinician, thinking, let's go closed-ended and talk to me about relationship with your mom.
Mhm.
Right? Because that's the earliest relationship he will have had with a member of the opposite sex, right? That's mom. So open-ended, as you allude to, followed up by closed-ended if you don't get the answer. That is, if George, for example, might employ avoidance as a defense to ensure that whatever that imminent threat is unconscious, doesn't come to conscious awareness. She's asking, in this case, she's asking, but I'm not willing to actually think of that. Other thoughts, other observations for George, just sticking with this character. What other characters you want to discuss this morning? We're discussing the baby shower.
So for Jerry, he with the cable, he didn't want it initially, and then he was able to be convinced by Kramer together, and then he continued to have like paranoia, like nightmares for the rest of the episode.
Yeah.
And that's kind of consistent with Jerry and the other episodes too, where he's convinced to doing things where
Yeah.
he doesn't want to.
Yeah, and for those of us who watched this episode last night in preparations for this morning's discussion, what perfect timing in terms of why Jerry was convinced, because he'll get the Mets game, right? So perfect timing for those of you who actually held out and watched this episode last night. So Jerry is operating at the level of his superego, saying, "No, this is not right. I don't want this." And then Kramer taps into some impulses. He taps into Jerry's unconscious and really plays on what Jerry really wants. And that is he wants to watch the Mets. He wants to indulge in his hobby, right, his passion. And that overwhelms the ego, where Jerry allows that impulse to come to conscious awareness. And then there's an observable action on that impulse. Specifically, he says yes to getting the cable illegally. However, it's not without consequence. When individuals entertain their impulsive desires, it's going to cause anxiety, right? And we see that play out with regard to Jerry's nightmare. So I don't know if Larry David actually discussed this with a psychologist or a psychiatrist, but what we see in this scene actually is a very nice cursory review of the Freudian psychosexual theory of what guides and governs human behavior. And that is this interplay between what we want, our id impulse, and what we are or believe we are allowed, that is our superego. And the interplay between the two, which is that friction that Freud called anxiety. Right? Now, to alleviate anxiety in general, the ego, that third and final component, of the Freudian unconscious will mediate and moderate this friction, therefore alleviating anxiety. I don't know if we see that actually play out in this episode. Now we know Jerry is a comedian, so I would assume that humor is going to be the defense that he's going to feel most comfortable employing. It's again, it's an unconscious process. But I don't know if we really see Jerry manifest a defense that we can discuss right now so that you can remember it in 5 or so weeks for your self-exam. But we certainly see the first 2 steps towards this. Jerry says no initially. He's operating at the level of a superego. And similar to George, perhaps thanking his parents for all we see in this episode, these maladaptive relationships with the members of the opposite sex. We could also thank Jerry's parents with regard to how they structured his superego, how that superego came to be, which begins probably around 2 years of age. Thank you, Mr. and Mrs. Seinfeld. Unfortunately, in this case, in this particular episode, it is overwhelmed, or fortunately, resulting in that friction or anxiety. Other thoughts about Jerry?
I think with that situation, it's kind of, as compared to George, it might not be that relatable being mad about a date like years later. But this, like a stressor and then maybe having a dream about it, I think is a more relatable thing. Like I know, like I have a big test the next day, like I might be dreaming about whatever content's on the exam the night before. And as annoying as it is, like I think that's more relatable for people. To be
Yeah.
like, oh, I've experienced that.
Yep. And I think even more than and more consistent than nightmares or dreams related to a stressor would be the intrusive thoughts while awake, right? They're even more prevalent. Yeah, and again, not that it necessarily plays out to be quote unquote normal for George, but that's what George struggles with, is those intrusive thoughts. So again, we could make it real time and talk about things like shelf exams. Irrespective of how wonderful your rotation is the next 5 weeks, there's an element of stress when it comes to being a 3rd-year clerk in psychiatry. I can't see why, but some people tell me that. And hopefully we don't give you nightmares, but we probably are going to give you some intrusive thoughts. Leaving today, did I check that lab correctly? Did I report that patient finding the way Dr. T wanted it, etc. So that does happen. Now, again, those intrusive thoughts hopefully don't result in clinically significant distress or impairment, because when they do, then we could use the D word. That's when things become disordered. And one example of that would be obsessive compulsive disorder. All right, but halfway through our discussion, what other observations did you make into their characters?
I have one other impersonal thing. So when George picks him up to like go home, the only question I had is what was he like expecting the outcome to be? Like what he want, like how was he expecting to turn that around? Especially when your friend is aware enough to be like, those people like picking up only evening. So given that they're friends and that they know each other's behavior so well, that was just a fun question. Like, what did you expect to happen?
And the expectation you're focusing on is when he goes to the actual baby shower, or picking up, or both?
No, it's like how did you expect your friend to respond when he finds out that you only picked him up for that weekend?
Yeah. Any thoughts? I mean, I'm not sure George even considered that. These are old time buddies. They've known each other at least since high school, and I think the relationship is at a point where I'm not sure George even considers that would be.
But then why go through the outfit like find legacy if everyone knows what everyone is trying to do?
That's a good point. And I don't know if
TV show, so
I think bringing your point more towards what George expects to be carried through and processed at the baby shower is clinically relevant, because there it allows us to discuss another defense mechanism called undoing, right? So individuals with, again, obsessive compulsive disorder do employ this defense mechanism of undoing, this act that allows you to go back and resolve a past issue. And clearly he's stuck on that date. And he thought that by confronting this woman years, if not decades later, he would be able to actually resolve and work through and get past what had happened to him. In terms of what George's expectation was when meeting with Jerry, That's anybody's guess. And you'll see this come up recurring with this particular situational comedy. These friends sometimes, this group sometimes interacts in a way that just defies human behavior or the rules to human behavior if there are rules. Other thoughts? Got about 5 minutes left.
I suppose while we're on that scene, of George picking up, Jerry from the airport, I interpreted his kind of, emotional outburst of explaining why he's so fixated on safety Jerry. At least how I interpret it as, example of defensive projection. When he says, I'm a loser, like, do you think I'm a loser? Do you think I want to be humiliated? Do you think I'm a masochist? And talking about like what she thinks of him, but I think we see throughout the show that he has very low self-esteem, and a lot of times he might perceive himself that way. We talk about his external appeal of control, his desire to get everybody around to like him. And so I see that as like not really coming from her, but a form of his own perception of himself and projecting onto her.
Now, I like that idea a lot. I mean, again, projection is the reattribution of an impulse onto someone else, so that you allow yourself to become consciously aware of it, but that reattribution or misattribution is less threatening. It's much more comfortable for a person to accuse somebody else of that impulse that they have, right? So it's a way to be able to express it, but then again, not own it, which is the whole, again, distortion of reality is really what all defense mechanisms are made of. That said, what's interesting is that if this particular defense mechanism becomes chronic, it is likely to result in paranoia, right? And maybe even the paranoid personality disorder in particular, right? Yet it's Jerry that we see become paranoid in this episode. So again, getting to this idea that these two friends are kindred, that they're connected, if not enmeshed. We have the defense mechanism demonstrated by George, and a potential negative consequence of that mechanism demonstrated in Jerry. So it's kind of a nice observation. Final thoughts. So nobody brought up the actual object really of this episode that bears the title. The bride and the mom to be makes a comment about getting a cesarean section. Remember her comment?
Oh, how she like planned to do
Why?
it. It seems like she likes control.
She does. What did she say? What was the patient's self-report?
I don't remember the exact
Didn't she
words.
say that her OB said that the birth would make her psychotic?
Oh, yeah.
What does that allude to? Other than a prejudice towards women in pregnancy?
Underlying mental health
More
issues.
specific, yeah. What underlying mental health issues do you think is going on here? Depression, so certainly peripartum depression. Quick teaching point, might come up on the boards, might come up on the shelf. 50% of depressive symptoms tend to occur during pregnancy, resulting in 2013, the APA changing the name of postpartum depression to peripartum depression. So that can certainly be. So my first question would be, is there any past psychiatric history of depression in this patient? And this, I think, is her first baby. So we're not worried about prior episodes of peripartum depression, per se. See that quickly on a Friday. What else, though? Because she actually used the word psychotic. And let's say that the answer is yes. There are prior episodes of depression, maybe two prior episodes. The first when she was 19. Throwing it out there and trying to write a script for Larry David here as a prequel. She didn't say, my doctor said I'd be depressed. She said psychotic. I thought she used the word psychotic, right? So what's the other condition that you might consider here?
Postpartum psychosis.
Exactly, right. And postpartum psychosis does predominantly present postpartum following delivery within 30 days.
Mhm.
And there the individual actually has delusions, usually delusions, but they can have perceptual disturbances too. There are two potential etiologies for postpartum psychosis. Anybody know what they are? So the one is that it's postpartum depression that evolves into a major depressive episode with psychotic features, now postpartum psychosis. The other etiology is thought that the trauma of childbirth unmasks a latent or occult bipolar disorder. And that would paint, that's why I said 19 years of age with her first depressive episode. Individuals who have their first depressive episode young, that is a decade prior, it's usually 29 years of age, maybe even older than that in terms of epidemiologic data. We have to think bipolar. And when that occurs a decade early, 19 years of age. And in such cases, even without any prior manic episodes, maybe postpartum psychosis in this particular patient, this particular character, would be that method or that etiology of bipolar illness. That's something to consider. Right? All right, 20 after the hour, we're going to end it here. Give us 5 minutes, and then we're going to log right back on for table rounds.